6, 7, 8, 9, 10. 10 days he's been absent in the last 2 months. And it seems like by the time I get him caught up, it just starts all over again.
Ben was one of my best students at the beginning of the year, but when they get so far behind, they feel they don't fit in. I've seen him lose his self-confidence, and his grades are really starting to suffer.
It's a shame.
According to the Centers for Disease Control and Prevention, the CDC, nearly 22 million school days are lost every year due to the common cold alone. That's nothing to sneeze at. When students, staff, and volunteers share the same spaces and materials day after day, illnesses can be passed on. We need to stop this spread of germs to prevent people from becoming infected unnecessarily and to reduce absenteeism. How can we do this? By learning the basics of infection control. In this program, you'll learn about common infections and how they are spread. We'll discuss routes of transmission, including contact, droplet, and airborne transmission. Finally, we'll teach you proper hand washing techniques, as well as other practical infection control practices. Whether it's the most common infections in schools, like colds and flu, or infections like hepatitis B or MRSA, all infections need 3 key ingredients to spread. Ingredient 1, you need a source, a place where infectious pathogens come from. One of the most common is human sources. This includes staff members, volunteers, and students who come to school sick. Your environment can also be a source of infection. Viruses and bacteria can also live outside of the body, on surfaces contaminated with blood or body fluids, in some cases for weeks or months. Take this computer station where a sick child sat, or this pencil a child just sneezed on, or this refrigerator in the faculty lounge. Ingredient 2, infections need a host. An unsuspecting person who's in the wrong place at the wrong time and just happens to be susceptible at that moment. Now, you can't eliminate the source. Schools are full of human sources, and there will always be lots of susceptible hosts. What we can eliminate is ingredient 3, a route of transmission. Some pathway for infectious pathogens to travel from the source to the host. In schools, the most common routes of transmission are contact transmission and droplet transmission. Airborne transmission is also possible, though less common. Contact transmission can involve direct contact or indirect contact. Direct contact transmission is just like it sounds, direct body surface to body surface contact between the source person's body, or his blood or body fluids, and the host's body. Direct contact transmission can occur when you shake an infected person's unwashed hand, or touch a bleeding cut or scrape. Indirect contact means the infectious pathogen is spread indirectly, such as when you touch something in the environment that's contaminated with infectious material. Gastroenteritis, or the stomach flu, a common infection in school-aged children who don't wash their hands, spreads by indirect contact, for example, when students share drinks or food. Remember, bacteria and viruses are extraordinarily tiny. Think 40 million in 1 gram of dirt. So surfaces like drink straws, tables, desks, door handles, and athletic equipment can all be contaminated with infected blood or body fluids, and you'd never suspect a thing. The key, however, is that the infectious pathogen has to get inside your body in order to infect you, through breaks in your skin, such as a cut, scratch, or acne. It can also get into your mucous membranes if your hands are contaminated and you touch your eyes, nose, or mouth. Blood-borne pathogens are disease-causing organisms found in the blood and certain body fluids of infected people and are spread by contact transmission. Examples of BBPs include human immunodeficiency virus, or HIV, hepatitis B, and hepatitis C. HIV is a virus that can weaken the immune system and cause acquired immunodeficiency syndrome, or AIDS. Hepatitis B and hepatitis C are also viral infections, but they affect the liver. Both types can lead to chronic liver disease, liver cancer, even death. In the community, HIV and hepatitis are typically spread through unprotected sex, IV drug use, and needles contaminated with infected blood or body fluids. In schools, HIV and hepatitis can be spread when students, staff, or volunteers touch blood or body fluids from an infected person. Often, you can't tell if someone is infected just by looking at them. They might not have any symptoms and may look perfectly fine, but they are still contagious and can spread the virus unknowingly. Take Susan, for instance. She is infected with hepatitis B. Her infected mother passed it on to her at birth. Susan had a bloody nose today and left her tissues on her desk. What if her teacher comes along and picks up those contaminated tissues without wearing gloves? And what if the teacher just happens to have a paper cut on her hand? That means the bacteria and viruses get a direct route into her bloodstream. Infection control is all about making sure you don't give infectious pathogens that opportunity. Methicillin-resistant Staphylococcus aureus, or MRSA, is another infectious disease spread through contact transmission. MRSA is a so-called superbug, a type of bacteria that's resistant to most of our strongest antibiotics. The bacteria are most often spread by direct skin-to-skin contact with a contaminated person, during contact sports, for instance. It can also spread through indirect contact, when a student or staff member touches a contaminated surface or object like this athletic equipment. MRSA infections typically appear as pustules or boils, which are red, swollen, painful, or have pus or other drainage. Or the infection might look like a spider bite that won't heal. Students with these symptoms should be referred to the school nurse immediately. Conjunctivitis, or pink eye, is a common infectious disease in schools spread by contact transmission. A susceptible person can directly contact discharge from the eyes of an infected person, or the virus can be spread indirectly when students share contaminated eye cosmetics or equipment like a microscope. Infectious mononucleosis, or mono, is another disease you should be aware of. It's known as the kissing disease. Although it is not highly contagious, it can be spread by direct person-to-person contact. The best way to prevent direct and indirect contact transmission is the simplest. Everyone, teachers, staff, students, and volunteers, should wash their hands throughout the day and always keep nicks, cuts, and wounds covered with a clean, dry bandage until healed. Your skin provides a natural protective barrier against bloodborne pathogens and other infections, so a simple bandage can shut down that route so no infections can enter your body. When you need to dispose of potentially contaminated tissues or personal items, always wear single-use disposable gloves. Instruct students not to share items that may be contaminated with saliva. Also remind students to avoid sharing personal items that come into contact with bare skin, such as towels, soap, or makeup. They should also use a barrier between their skin and public shared equipment, like this weight training bench. Droplet transmission is the second most common way infections spread in schools. Droplet transmission happens when a source person, like Tammy here, who's coming down with the flu, releases tiny infectious droplets as she talks or when she coughs or sneezes. Droplets can be propelled up to 3 feet and can land on an unsuspecting person's nose or mouth and get into their bloodstream. Droplets can also land on frequently touched surfaces, like a desk or computer keyboard. If a student or staff member touches the contaminated surface and then rubs her eyes, she could become infected. Colds and flu viruses spread through droplet transmission, mainly through coughing or sneezing, or when touching surfaces or objects contaminated with secretions. Airborne transmission is the third way infections can spread. Measles and tuberculosis are highly infectious viral diseases that can lead to serious complications and are spread by airborne transmission. Airborne transmission happens when dust particles containing infectious bacteria or microorganisms remain suspended in the air for long periods of time. These microorganisms are then inhaled by a susceptible host nearby, or the microorganisms can be carried by air currents to infect people at a greater distance. The best way to prevent both droplet and airborne transmission is to keep your hands clean. You should also dispose of articles soiled with nose and throat discharges carefully. Use gloves or use a barrier to protect your skin. Keep the environment clean and regularly disinfect commonly touched surfaces. Remember to cover your nose and mouth when you cough or sneeze, and remind students to do the same. Use a tissue whenever possible. However, if tissues aren't available, you and your students can use the sneeze in your sleeve trick, also known as the sneeze in the elbow trick. When you have to sneeze or cough, cover your nose and mouth with your sleeve or elbow. Then wash your hands with soap and water as soon as possible. You can use an alcohol-based sanitizer to clean your hands if you aren't near a sink, but you should wash your hands as soon as you can get to soap and water. Our hands are the part of our body most exposed to these pathogens because we're always touching things. That's why, according to the CDC, hand washing is the single most effective weapon in the fight against infectious diseases. Plain old soap and water. Here's how to wash the right way. Wet your hands with soap and warm water. Rub your hands together to make a lather, scrubbing all surfaces, wrists, fingernails, and between fingers. Continue rubbing your hands for 20 seconds. Imagine singing Happy Birthday twice, or run through the alphabet once in your mind. Now, rinse your hands well under running water and turn off the faucet. If possible, use a clean paper towel, not your clean hands. Dry your hands with a paper towel or air dryer. Students, staff, and volunteers need to wash their hands throughout the day, and most importantly, when hands are visibly dirty or contaminated with blood or body fluids or secretions like mucus or feces, before eating, drinking, handling contact lenses, or applying makeup, after blowing your nose, coughing, or sneezing, before and after bandaging a cut or wound, and after handling animals or animal waste. If you don't have a sink nearby, use an alcohol-based hand wipe or gel sanitizer. Just apply the recommended amount of product to the palm of one hand and rub your hands together, covering all surfaces of your hands and fingers until your hands are dry. The gel doesn't need water to work. The alcohol in it kills germs on your hands, but remember, wash your hands thoroughly with soap and water as soon as possible. Everyone is potentially contagious. Bacteria, viruses, fungi, and parasites that cause infections live on our skin, in our mouth, nose, and eyes, and in our blood and body fluids. There are several ways to stop the spread of infections. One important way is by practicing standard precautions. Standard precautions combine the major features of universal precautions, which are designed to reduce the transmission of bloodborne pathogens, and body substance isolation, which is designed to reduce the transmission of pathogens from moist body substances. Standard precautions are effective because they require you to treat everyone as if they had HIV or any other serious contagious disease, no matter how healthy they may look. Standard precautions include hand washing, using protective equipment, handling blood and other body fluids safely, disposing of contaminated materials and objects correctly, and cleaning and sanitizing the environment. Be diligent in following the hand washing guidelines we talked about earlier, and make sure you encourage students to follow the same practices. The CDC states that students who wash their hands at least 4 times a day have 24% fewer absences from respiratory illnesses like the cold and flu, and half the absences from the stomach flu. Staff and volunteers should have access to first aid supplies that include barriers such as gloves, eye protection, and face shields. Make sure you wear disposable, single-use gloves whenever there is a chance you could contact potentially contaminated blood or body fluids, such as when handling other people's litter. Used napkins, tissues, and Band-Aids can all carry pathogens, so never pick up litter with bare hands. To avoid handling contaminated litter in the first place, encourage students to dispose of their own hazardous waste. For example, if they use paper towels to stop a bloody nose or tissues to wipe a runny nose, it's important that the students throw them away immediately so no one else gets infected. Then they should wash their hands. The same thing goes for used bandages and dirty towels in the locker room. If a student or coworker gets injured and is bleeding, have someone call for emergency personnel if necessary. Then protect yourself. Your first instinct may be to rush to help the person, but take a few extra seconds to put on disposable latex or vinyl gloves. Report the incident so that someone who is trained to clean up infectious materials is alerted. Teach students to report any incident that involves blood or body fluids to a teacher, staff member, volunteer, or bus driver. Anything they have soiled with blood or body fluids should be cleaned up by someone trained and authorized to do so. If you are doing the cleaning, wear waterproof utility gloves and follow your school's procedures for cleaning hazardous waste. If your gloves or other protective equipment is penetrated by blood or other infectious material, remove it immediately. Always remove gloves so that your bare skin never touches the outside of the gloves. Carefully peel one glove from the top of the wrist to the fingertips, then hold it in the gloved hand. With the exposed hand, peel the second glove off, tucking the first glove inside the second. Dispose of contaminated protective equipment according to your school's exposure control plan. Then wash your hands with soap and water. If blood or body fluids get on your skin, wash it off as soon as possible. If blood or body fluids enter your eyes, nose, or mouth, flush the area with running water as soon as possible. If you get blood or body fluids on your clothes or shoes, remove them as soon as you can and wash the exposed skin. If a student's clothes or shoes become contaminated, make sure they are removed and the exposed skin is washed. Then follow your facility's policy for decontaminating or disposing of contaminated items. If you think you've been exposed to HIV, HBV, or HCV, do not panic. Most exposures in schools do not result in disease. Wash the exposed area right away, then report the incident to your supervisor. This way, any post-exposure treatment can begin immediately. Other guidelines for preventing the spread of infections include the following. Use a broom and dustpan to pick up broken glass, not your hands. Or better yet, call a custodian. Place bloody waste in a sealed, color-coded, leak-proof container that is labeled biohazard and dispose of as hazardous waste. If cloth towels are contaminated with blood or body fluids, they need to be handled as little as possible and also placed in color-coded bags or containers. Remind students to keep their hands away from their eyes, nose, and mouth. You should follow the same advice. Also remind students not to share anything that has been in someone else's mouth, such as straws, lip balm, or pencils, or anything that has touched their eyes, such as cosmetics, contact lenses, or equipment, such as microscopes. Teachers, staff members, and volunteers can also spread disease, so keeping yourself healthy is just as important as teaching your students about healthy habits. When you're sick or have flu symptoms, stay home, get plenty of rest, and check with a healthcare provider as needed. Keeping your distance from others may protect them from getting sick. Finally, since teachers and volunteers spend several continuous hours a day with their students, they're in an excellent position to detect early physical and behavioral changes in students at school. Stay on the lookout for some of the common symptoms of infectious diseases in students, such as loss of appetite, unusual behavior, fever, unusual skin color or rashes, breathing difficulties, headaches, vomiting, sore throat, cough, and nasal discharge. Students with these symptoms should be referred to the school nurse. The decision to exclude infected students will be made according to facility guidelines. Certain infections require reporting to state or local health departments. Practice healthy habits and teach students to do the same. Simple actions like hand washing, good housekeeping and sneezing in our sleeves can stop the spread of germs in schools and reduce absenteeism.